I want you to close your eyes and imagine. Your mother dies even before you grow up. You end up not coping in what is left of your family environment and become homeless. You meet someone who seems nice, and you start what you hope will be a better life with them. You are shocked that severe domestic abuse becomes the next step in the relationship. After a couple of failed relationships, you become a single parent, trying to live on your own with your own children. You deal with the resulting anxiety and depression that has manifested in your child while you deal with your own anxiety, financial distress, and accompanying insomnia. You cannot find the help that you need so desperately. You need help the most late at night when you have stopped work and got your child to bed. But there is nothing available. All services are closed. The internet is all over the place, and so much reading. You are too tired to read, and so much information on the off chance that what you need is somewhere out there. You are permanently tired and worried about the future. Now open your eyes. This is my background, and a similar background to many people globally. This is why I saw a need to create a digital mental health gateway. I lived with family members with significant mental health issues. I found no single resource that catered for my needs appropriately online. I resolved to make a portal that would direct people like me to the best help available easily, as immediately as possible, for no cost and 24/7. From this, I sourced volunteer medical, psychological and IT professionals to assist me to develop the content and functionality of this gateway. This project has been entirely self-funded. The self-funding, however, is not sustainable, and in order to allow us to keep this resource flourishing and growing and meeting any needs that you or others may have, we need financial help. It takes a lot of time, money, and people power to be constantly resourcing such quality links and resources, such as advice and content from psychology, psychotherapy, social worker, GP, mental health, nursing, and more. It is an almost constant job checking that resources behind links still exist, that they haven't changed, reviewing their changed content, and finding changed URL addresses. We want to develop more apps and resources, and although we have prepared most of the content for many self-help and therapeutic apps, ebooks and more, the actual build of these tools takes money that we don't as of yet have. We already offer for free an intuitive resource that drills down to all the best possible online and free help. We have paid for and published 2 apps. Our first app is a mobile app of our website. Our next app, which is also available at no cost, is a domestic violence and bullying app that has many cool safety tools. We have other apps partially built around many other wellbeing issues. We also have ebooks and e-tools and more that need funding to complete. Our material has been reviewed and tested by the Swinburne University Capstone Project and has been called world class. Please help us to help you or those you love who in the future may need a resource such as this. If you are lucky enough not to need this service, please help us to make a community better and safer for all. Thank you for taking the time to listen to this presentation.